Yeah, I used to have trouble with my big toes and I thought it was gout. I went to the doctors and this doctor says, no, it's probably arthritis. And he says, just out of chance, he says, I'll say, because of your age, I'll send you for a PSA. And I went away on holiday that week. And when I come back, there was a letter there. And I knew that it was from him. I thought, oh God, here we go. And then from there, he sent me to here. I had further PSAs, scans, bone scans, the lot. And obviously it was prostate cancer. And then Dr. McGovern says, would you be willing to participate in any trial? And I went, well, I'm taking something out of the National Health, so I'll put something back in. So I says, yes. I says, I'll give it a trial. And that's when it started, 6.5, 7 years ago.
Prostate cancer is the most common cancer in men in the UK. More than 52,000 people are diagnosed with prostate cancer each year. Stampede is a clinical trial that looks at the best way of treating advanced prostate cancer. Since it started in 2005, almost 12,000 people with advanced prostate cancer have taken part in it, making Stampede the largest trial for advanced prostate cancer. In this film, we explore the most recent results from Stampede, which looked at 2 different treatment combinations. Gert Attard is a professor at the UCL Cancer Institute and the co-lead of this part of Stampede, and he explains the rationale behind these 2 comparisons.
So for 60 years we have known that if we block male hormone, prostate cancer responds. And that remained the standard backbone. So all our men receive injections which block male hormone. In the late 2000s, so 2010, 2011, we started to show results with tablets that act on top of the injections. So where the injection blocks about 80% of male hormones, these tablets block the remaining 20%. And the first 2 of these tablets to be tested were called abiraterone and enzalutamide. These were the first 2. And they were tested for men whose cancer had come back on the injections, that had chemotherapy, that had some other treatments. And then when used in that space, they were shown to improve life expectancy. The tumor responded and patients lived longer, although the benefit was probably somewhat limited. It was a great advance, but overall, the cancer always came back. So what Stampede has been testing is whether when we start those treatments at the same time as the injections, rather than waiting for the cancer to come back and having several other treatments, whether when we start at the beginning, whether that is even more effective.
Around 4,000 people who were starting long-term hormone treatment took part in these 2 comparisons. One looked at the benefits of adding abiraterone to standard treatment, and the other looked at the benefits of adding both abiraterone and enzalutamide to the standard treatment. In both comparisons, trial participants were followed up for at least 7 years since they were randomized. Nick James, professor at the Institute of Cancer Research and chief investigator of the Stampede trial, told us about the main findings from these comparisons.
So the results are in 2 parts. We separated into men whose cancer had spread, men whose cancers hadn't spread, but were at high risk of doing so. So we earlier on this year presented the data from the first group, the men with the cancers that hadn't spread. What we found was that just 2 years of treatment with abiraterone or abiraterone plus enzalutamide halved your risk of death from prostate cancer, and it appears that 2 years was sufficient to do that. So that's a really important result.
So, adding abiraterone with or without enzalutamide not only improves survival of people at the early stages of the disease, but it also decreased the chance of the cancer spreading. Results from the second group, those people whose cancer had spread outside the prostate, also confirmed that using abiraterone with or without enzalutamide improved survival, and it also helped prevent the cancer from coming back. So these results provide clear evidence that adding abiraterone to the current standard treatment benefits people with prostate cancer both at the early stages of the disease and once the cancer has already spread. Gerd talks about earlier research into using abiraterone to treat prostate cancer before Stampede.
From the first patient where we saw a drop in PSA, and these were men with a very short life expectancy, and we're seeing drops in PSA and they're still on treatment 2 years after, 3 years after. It's really been a rewarding experience.
It's over the years that a trial is actually proven. And the PSA kept dropping and dropping and dropping until it was non-detectable. So the tablets have worked. I think it's great. Great.
Men now have much longer survival than they did when we set the trial up, and this is not solely down to us, but it is substantially down to the advances driven by Stampede.
So, because abiraterone helped both groups of people to live longer, these findings strongly recommend adding abiraterone to the standard treatment to treat prostate cancer that has or has not spread to other parts of the body. Stampede also tested if giving both drugs on top of the standard treatment would result in even better outcomes than just adding abiraterone alone.
What we had hoped to show was that the combination would give you an even bigger gain than either drug on its own, but unfortunately it didn't look like that was the case. It looked like we saw the same benefit but no extra benefit. So the conclusion was that one drug is sufficient, you don't need two.
Although it was disappointing in a way that enzalutamide didn't bring more for patient benefit than abiraterone, we can still be very happy with the fact that abiraterone is just doing so fantastically well. And we've got evidence now to spare patients all the additional toxicity that would have happened if they were being given lots and lots of therapies, which they just don't need. The fact that the results were A, virtually identical, B, across all the outcomes we looked at. The data were really very uncontroversial. They are so clear-cut in terms of benefit for patients. It was all nice and clear, which often doesn't happen in clinical trials. You don't get a barn door obvious results. But this is a great example of where we saw one, and it was fantastic to be part of seeing it.
Thanks to its multi-arm, multi-stage design, Stampede has been able to test a total of 10 different treatments over 18 years, and it has directly improved prostate cancer treatment 4 times. With these new treatments, patients are now living longer with a better quality of life.
The results basically mean that there is hope that somebody like me, even when my disease progresses, which is very likely to do, will be able to enjoy good quality of life for a pretty extended period. Yes, it comes at a price, but there are no free lunches in this life. And the longer I live, the longer the chances that some further therapies will come along, which will actually allow me to be rid of this damn disease completely.
It's lovely to think that there might be some sort of silver bullet somewhere that's going to solve all cancer troubles, but unfortunately that's not the way it is. And it's painstaking research by some of our brilliant clinicians that edges us forward a little bit at a time. And of course, it's also down thanks to patients, because there'd be no clinical trials without patients. So great congratulations to all the people that have taken part, 12,000 men in the Stampede trial since it first started.
Recruitment for Stampede is now closed, and the team are already working to set up a new trial. Stampede 2 will integrate all the lessons learned from Stampede to keep delivering impactful research and improvements in care for people with prostate cancer.